Sedation dentistry. You like sedation dentistry.
Absolutely. In fact, I think it's essential for some people.
Okay.
You know, being afraid of the dentist is not unusual. A lot of people, they can't even visit the dentist because they feel so much anxiety about it. And I have found that if we can relax them and put them in a situation where they can feel comfortable, they can get the care that they need to get. So what I do in my office is I do 2 different types of sedation. I do what I call oral sedation with pills. And if we need to do more than that, I do offer IV sedation.
Okay.
Between those 2, we can handle everybody.
So they're all numbed up, obviously.
Absolutely. So anytime anybody does any kind of sedation, we want them to be as comfortable as possible, which requires that we use the anesthetic to make it so they can't feel anything. And in addition to that, we offer sedation. And if that's something that they want or need, it's absolutely available to anybody that might need it.
Is this true that for some people, it's like they're going, this is so much less of a pain issue than I thought it was going to be?
Absolutely.
I mean, you hear that a lot?
All the time. So, you know, 90% of my patients, they are able to do this with just the pills, not even IV sedation, successfully. Okay. And invariably what I see is that it's people's expectation of pain that is really the concern. And once they know that they're not feeling anything, all of a sudden they just relax so much.
Now, what about the next day? What do they take? Over the counter?
Yeah.
Or can you prescribe medications?
So I can do both. So there's over-the-counter medications that I provide for them. I do combinations that have been proven to be most helpful, most beneficial to them. In addition to that, I can prescribe medications that are a little bit stronger. So it's whatever they want to do, I am able to help them.
Are there some people that could deal with it with just over-the-counter stuff?
Absolutely. In fact, I've had people come in the day after surgery, and these are big surgeries sometimes, right? Come in the next day telling me how wonderful they feel, that they never used any medications at all, that they feel better than they've ever felt in the last 20 years. I think part of that is like they have no more infection after we're done. They don't have teeth that are hurting them chronically for years.
Okay.
So yeah, my experience is that everybody can be taken care of, that it's going to be better than you expect, and that you're going to feel way better after everything is done.
What are those medications over the counter?
Yeah, so I like to use a combination of Tylenol and ibuprofen. So
and that does the trick.
It does the trick. Yeah.
Okay.
So it works on 2 different parts of your nervous system to calm down your pain, what you feel in pain. Right? Okay. So it does it together. In addition to that, some people like to use something with a narcotic in it, like Percocet or Vicodin. We can do that if necessary. And then in addition to that, like I'll give you a steroid. A steroid helps you heal faster. It helps your body do a better job at healing overall. So all these little things are to help you out, to make you feel better so that you don't have to have a rough transition from the day of surgery to when you feel 100% whole.
Is this true that for the true phobics, that even the night before you might have to give them a pill so they sleep?
Yeah, so
Is that rare? Or...
No, it's not rare. Like I do that. I want people to be comfortable. I want people to have a good night of sleep. So I do provide different medications, and it helps them to just be relaxed and calm.
And they just need a ride home after the procedure.
Yeah. So no matter what we do for people, as long as there's any kind of sedation happening, they will need somebody to bring them to the appointment and someone to bring them home from the appointment. So that's absolutely necessary.